Welcome to the Sensational Sex Podcast, where we help women in long-term relationships thrive after the honeymoon stage is over. Are you a woman who wants a deep, intimate, and satisfying connection with her partner? Of course you do. Amy Rowan and Dr. Trina Reed have the answers, and all you have to do is join us each week and take a small step. Soon enough, you'll be that woman who effortlessly has a satisfying sex life. Follow us on social media at Sensational Sex Podcast. Share this episode. Return next week. Leave a review. And thank you so much for subscribing. Now, let's start the show.
Hello, beautiful people. Thank you for listening to the Sensational Sex Podcast. We're so happy that you've come along for the ride.
Even though your sex life will never be perfect, you can create a sex life that is perfect for you. And we're here to help you with that.
In this podcast, we're getting real with the topic that no one wants to talk about. Are you ready?
I think so.
We're discussing how intercourse can become uncomfortable and even painful for 85% of women.
Which is the majority of women. So if you are a woman, this can be prevented, but only if you stay on top of it. And if you are a man, the chances are really high that this is going to happen to your female partner, and you need to be supportive.
In this podcast, you will learn about the difference between bacterial vaginosis and a urinary tract infection. We'll then discuss vaginal dryness versus vaginal atrophy. And all of these can cause painful intercourse. And painful intercourse usually means zero intercourse.
So there's just one big problem, and that is women do not know how to talk about this. So Amy and we are starting this conversation that has rendered millions, possibly billions of women silent. And the repercussions of her silence is full stop on her sexuality and sexual pleasure.
Let's repeat that. Even though this is preventable, sex ends, full stop. And nothing is done because women feel too much shame.
So to help us all get comfortable with letting go of our shame, I am going to reveal 3 shameful confessions I've never shared before, 2 of which I have not even shared with my husband.
Mm-hmm. The good news is, with one click of a button, quality of your life, sensuality, and sexuality can increase as you age.
If that sounds good to you, then please stick around. In this podcast, we are giving you 4 research-backed ideas that are easy to do, and best of all, they're natural and will work with your body.
That's exciting.
Yeah.
That's all we can ask for.
Yes.
So please hit the subscribe button, like, and leave a comment.
Your support helps grow our channel and women's sexual pleasure.
We were lucky enough to partner with a company called New Eve, created by Dr. Renji Chang, who is a scientist and gynecologist.
I love that combination of scientist and gynecologist. It's really weighty. Mm-hmm. So New Eve is a natural remedy that works using nutrients taken both orally, topically, and vaginally to nourish your tissues, promote collagen and elasticity, and restoring your body's normal sexual functions.
I really like this because it's a layered approach and it covers all of the bases. And you can check out the entire New Eve product line that we're going to dig into. You're going to find an affiliate link in the description. And hooray, you can get a 5% discount by using the code SSP.
I always love a good discount.
Mm-hmm.
And Amy, I think it's really interesting and ironic that so many people are drawn to the how to have a bigger, better orgasm types of videos that talk about sexual technique, when this extremely unsexy topic of your vaginal and vulva health is a pillar to a woman being able to have bigger, better orgasms as she ages.
Viagra launched in March 1998. That was 27 years ago. I don't know if you remember, but Bob Dole, who was a very high-profile politician at the time, he did a Viagra commercial, and it got a ton of press. And it made having erectile dysfunction seem a lot less shameful, and it took away a lot of the stigma.
And even though I'm sincerely happy for men, women never got the same get out of jail, shame-free card. So then in 2011, a woman by the name of Cindy Eckhart launched a drug called Agi, which is to aid in hypoactive sexual disorder. So I followed the Agi launch and progress really closely, and I can say for sure that Agi never got the same amount of press as Viagra.
No. And this is so much bigger than simply being able to have comfortable intercourse. This is a complete quality of life issue, and it affects so many areas, which we're going to get into.
So everyone who is listening, we all need to stop this stigma and shame for something that's going to happen to women naturally. And we really need to unabashedly tackle talking about painful intercourse.
Vaginal dryness is a natural consequence of aging, and it's frequently overmedicated with hormones. And there are many women who don't want hormones or may not be able to take hormones.
So Nueve made 2 scientific breakthroughs in women's health and developed natural alternative products for relieving vaginal dryness safely by waking up dried mucus glands.
So let's start at the start and break down some of these different types of conditions that can cause vaginal dryness and some of these other challenges. Beginning with bacterial vaginosis, or BV. This is a microbial imbalance rather than a true infection, and it can cause discomfort and pain of the vagina, which makes sex painful and uncomfortable.
So BV happens when natural bacterial levels are out of balance. So balanced levels of bacteria help keep your vagina healthy. But when too much of some bacteria grow, it can lead to BV.
Bacterial vaginosis can happen at any age. And here is a long list of things that can cause BV in women.
During a woman's reproductive years, hormone changes can make it easier for certain bacteria to grow.
Having unprotected sex and douching can upset the balance of vaginal bacteria.
Taking antibiotics can cause BV.
Wearing tight underwear or yoga pants can block airflow in the vaginal area.
Using heavily perfumed or antibacterial soap can promote bacterial growth.
Or wet clothing from exercise can also encourage bacterial growth.
Or being overweight, pregnant, or having diabetes can contribute to BV.
The important thing to note is that the hormone imbalance is often overmedicated with antibiotics, and this can potentially lead to drug resistance and secondary infections.
So Nueve developed natural alternative products that safely restore microbial balance with all natural ingredients.
It's easy to use and very effective. So what is the problem that stops women from taking charge of this easily solvable challenge? As we discussed, the majority of women may feel embarrassed, self-conscious, and ashamed. And women may feel unattractive and sexually inadequate.
So in my book, The Sex Course, the characters decide as a group to make shame their bitch. And I say in this podcast, Amy, we no longer tolerate the shameful nonsense that's holding women's sexual pleasure hostage. So you and I and everyone who's listening needs to make shame her bitch.
Oh, I love it. Let's do it.
Let's do it.
Ladies, your vagina works so hard for you and your vulva gives you so much pleasure. She's worth giving her some TLC.
So really all this is taking some researched, studied salve and putting it onto her vulva, and that's going to help her a lot. So what's stopping her from putting this on her vulva?
I think most women starting around the age 35, 40, 45, we know that we've got to start putting more moisturizer on our face in order to take good care of our face. And we need to make sure that we're wearing sunscreen every day and all of those things that we're doing to take care of our external appearance. And we need to apply that same level of care to our vulva, because just like we want our face and our skin and everything to continue to look beautiful and young and make us feel good about ourselves, I think we feel the same way about our vulvas.
Yeah, so Dr. Mary Cauldron, who was a sex educator like in 1910, so that's a long, long time ago. She coined the term donut hole sensibility to talk about a woman's vaginal area, to, the vulva. And I think it's very sad that we're here more than 100 years later and women still have this donut hole sensibility when it comes to her vulva and her vagina. Like you say, of course, every woman is going to get moisturizer and going to pay top dollar to moisturize and sunscreen her face and her hands. But then when it comes to her vulva, it's like, oh, it doesn't exist, or, there's that missing piece there.
I think the biggest barrier is that most women don't know that there are good solutions out there. They probably have gone to their doctor. They've been prescribed for bacterial vaginosis, boric acid or something like that. And that may clear up the infection, that may help, but it's not taking the layered approach with all of the nutrients and the salve and, all those additional things to help really, really nourish the tissues.
Yeah, it's more like a Band-Aid.
Yeah.
So your question might be, what is the difference between bacterial vaginosis and a urinary tract infection?
A urinary tract infection, or a UTI, affects the urinary tract, while bacterial vaginosis, or BV, is going to affect the vagina. Both of these can cause painful urination, but they have other differences in symptoms, causes, and treatment.
Basically, you will feel a UTI when you pee, and you will feel bacterial vaginosis in your vaginal area.
So using my vulva puppet, and if you're listening on the podcast, this would be a great time to switch over to YouTube so you can get the full visual. But here's the vulva, and if you open this up, you can see this is the vaginal opening, and the urethra is tucked up here. So if you have a UTI, you're going to be feeling a lot more of the pain up when you urinate, versus with BV, you're going to be feeling the pain in the vagina. During sex, bacteria can be pushed into the urethra, which can lead to a UTI. And the symptoms of a UTI are pain or burning when urinating, frequent urination, blood in the urine, fever, chills, nausea, and vomiting.
Oof. So with BV, there will be pain or itching in or around the vaginal entry. There will be a strong or fishy odor in the vaginal area and a grayish white discharge.
A UTI is diagnosed by growing bacteria from a urine sample. BV is diagnosed through a pelvic exam and lab tests.
So here's my first shameful revelation, Amy. I'm a sexologist, and I've mistaken a UTI for BV because I'd never heard of BV and assumed since it was tied down to that area down there, it had to be a UTI.
That's a very common experience. So I hope that we can remove some of your shame from that, Dr. Trina. I would bet that there are more women who have never heard of BV than who have. And I think that it could be getting a diagnosis that's going to stop too many women.
And it's not just getting the diagnosis. When I did have a UTI, I went to my walk-in clinic because it was the weekend and I couldn't go in to see my regular doctor. And I had to beg the on-call doctor for a urine sample. He was uncomfortable about talking about my vagina. And I can only imagine, if a woman is not a sexologist, how terrible that must be for her.
If you're uncomfortable getting this diagnosed, please listen. If left untreated, both UTIs and BV can lead to more serious complications.
Yeah, you really have to pay attention to it for sure. So there is a great treatment. Nueve Salve Nueve is the first and only remedy using research-backed nutrients to directly nourish the vulva tissues, supporting collagen and elasticity. This is going to relieve dryness, itching, atrophy, and painful intercourse.
They did an analysis of 182 surveys, and these surveys showed a highly significant healing effect. The salve moisturizes and nourishes the vulva with nutrients for vulvar dryness, itching, atrophy, and painful sex.
But don't take our word for it. Please go to the New Eve website and check out the more than 132 reviews. We'll link to that in the show notes below.
And FYI, New Eve also has an amazing product for urinary support for flushing the urinary tract.
So I've known my doctor for almost 20 years. And every time it comes to my vulva health, like getting a pap smear, I hate it. I just hate it. And like he's constantly nudging me to say, you need to get your pap smear. And I said to him one time, I'm just really uncomfortable. And he said to me, you know what, Trina, this is like talking about the weather for me. Like it's such not a big deal, you know, and he was really kind about it. But I just think it's interesting that even though I'm a sexologist and I preach this, you know, going through that experience is just uncomfortable.
You know, I suppose I'm on the flip side of this because I was thinking, and, you know, my dad is a retired OBGYN. And every time that I've gotten a UTI, I guess probably because I don't want to go through making an appointment, going to the doctor, explaining it to a doctor, I just call my dad and ask him to call in antibiotics for me. So my dad knows every time I get a UTI. Is that embarrassing? I don't know. But that's how I've always handled it. But I think for me, it's more of a convenience thing than a shame thing. Like I know I can go see the doctor, but it's just so much easier for me to call up my dad and get the prescription called in right away because I know that the last time I had a UTI, like I couldn't sit down. I was so miserable. I just had to walk back and forth. I couldn't sit down. I was like, I need this fixed. Like immediately. Like I cannot wait 24 hours for this. So
yeah, I see that this conversation is changing for the young generation. My 2 teenage boys had some friends over yesterday. It was a mixed crowd and they all just started talking about periods and that, you know, I was just sitting back gobsmacked. I'm like, what is happening here? And I feel like these young ladies do not have the same hangups as us. And I am just so grateful to all those mothers who raised those strong young women that they're sitting around my kitchen table talking about their period. Like, go mom. Thanks for that. Like, that's awesome. So for the rest of us who still feel the shame of talking about our vulva, who have a donut hole sensibility about our vulva, I feel like we need to step out of our comfort zone and just go there and take care of our vulva. And, you know, we're going to live through this. Like, we're not going to die.
No.
We're going to go through this. And when we get to the other side, we're going to have a much better quality of life.
I think the important thing to know is that you don't have to live with that pain and discomfort. There are effective research-backed solutions out there.
And they're easy solutions too.
Yeah.
They're easy solutions. So you can go online and order this online. You don't have to walk into a store. You don't have to go through a checkout person and they don't have to see that you can do this online. So it's all very private.
I think that makes it that much easier too, because to your point, I think a lot of people don't want to go to the doctor and explain it. So as long as you know what it is that you're experiencing, you know that it's BV versus a UTI. Now that we've broken that down for you, then you can easily head over to their website and order the right product. Speaking of quality of life, let's dig into the next super unsexy topic that's going to make your sex super sexy.
Yes.
Vaginal dryness and vaginal atrophy.
Ooh, why don't we add in clitoral atrophy too? Like, let's just put them all in there.
It's all part of it.
So sexy. The thing is, because all female reproductive systems go through menopause, vaginal atrophy is extremely common. Some studies suggest that anywhere between 50 to 85% of postmenopausal women will experience symptoms related to vaginal atrophy.
Additionally, many breast cancer survivors of any age may require treatment that involves blocking estrogen. And so those survivors will also experience this even before menopause.
Mm-hmm. So just to differentiate between vaginal dryness and vaginal atrophy, Vaginal dryness is the first stage to vaginal atrophy. It's a common condition in women where the vaginal walls become thin, inflamed, and dry.
It can cause pain, burning, and itching in the vaginal area. And sometimes it can also affect the vulva.
So there's a lot of things that can cause vaginal dryness that are not attached to aging. However, the main culprit is low estrogen levels, which can occur after menopause, childbirth, breastfeeding, cancer treatments, or anti-estrogen drugs.
And there are some non-hormonal factors that can also affect this, including cold and allergy medication, some antidepressants, and Sjogren's syndrome.
So here's what you may experience with vaginal dryness. There's going to be pain during intercourse when you're sitting, exercising, or urinating.
Burning or itching in the vaginal area.
You're going to have abnormal vaginal discharges.
You may be experiencing frequent or painful urination.
You can have soreness in the vulva region and recurrent urinary tract infections or UTIs or yeast infections. And I have a number of friends who experience both recurrent UTIs and recurrent yeast infections. And let me tell you, it is not pleasant.
UTIs and yeast infections are the absolute worst.
They are.
Lately, I've been getting them more frequently, and I'm not lying when I say I nearly lose my mind. They are so irritating and uncomfortable. I am a complete and total baby about it.
So when I was breastfeeding both my children, it was my first experience with painful intercourse. And I did try to speak to my doctor about it, and he brushed me off, saying it would end when I finished breastfeeding. And he was right. It did end when I finished breastfeeding, but I felt a lot of shame about being dismissed like that. And like the thing about this painful intercourse is it doesn't matter how much lubricant you use because it's not about being wet. It's about the vaginal opening being sore.
Mm. And for many women, some women breastfeed for 6 weeks, 2 months, year, 2 years. You know, many women have long breastfeeding journeys. And yes, it may end when you're done breastfeeding, but if you're breastfeeding for a year or two, you don't want to have painful intercourse that entire time.
No.
So here's my funny, kind of not funny story with painful intercourse. 6 weeks after my second child was born, I had a VBAC, and we were staying in a hotel room on that magic 6-week mark because we were out of town for a wedding that I was in. And my mother-in-law, she had come to be with the baby because I was a bridesmaid, and she was sharing the room with us. So I thought that would deter my husband from wanting to have intercourse at the 6-week mark because his mom was in the room with us. But not surprisingly, it didn't. Yeah.
Well, you're a better woman than I, because I would not have sex with my mother-in-law like in the next bed. Like,
that
would not be happening.
I mean, I was like, it's your mom. I don't know. It wasn't particularly comfortable. And, I think the thing that I'm still a little more resentful about is, we weren't able to take much time in order to make it better. And so I do remember feeling resentful during that time, but I was really trying to push through for him.
I think a lot of women push through,
yeah,
because they don't know how to talk to their partner about this. And I think if we just talk to our partner about this, they would be a lot more understanding, but they don't know what they don't know. They're working with what we tell them. Right. So, it's on us if we feel resentful.
Yeah.
Does that make sense?
Yeah. And honestly, what difference would have 2 more days made? I mean, I think for him, 2 more days sounded obviously like completely impossible, but so that's my story. But I think to your point, many women are pushing through to please their partner. And I was absolutely doing that at that time.
I think every woman probably has had this experience. So
yeah.
And here's my second shameful confession. So with my second son, I wrote a 6-month sex challenge blog that tracked my progress to get my sex back on track 6 weeks after baby. And I think it's really telling that I was way too ashamed to admit that intercourse was sometimes painful. Like I just couldn't admit that. And I was telling everybody about my sex life, like everything. Like I was going into detail about my sex life, but I was not talking about the painful sex.
Thank you for sharing that, Trina. Even though we are sexologists, we are also still women, and we also feel shame when our bodies aren't working the way that we want them to. And sometimes that shame can be even deeper because I think we feel like we need to hold ourselves up as some sort of example of like perfect sex all the time, but it's not perfect sex all the time.
Yeah. I just remember those days I was just trying to get through the day.
Yeah.
And,
Sure.
if I had sex, it was to be celebrated. And, like I was just trying to make it happen. And I wasn't really taking my own self-care into consideration, all that stuff that women do.
Yeah.
So
of course.
I sure wish at that time, at that moment in my life, I had a New Weave moisturizer because it's the first and only remedy using research-backed nutrients that directly nourish the vaginal wall tissues, the supporting collagen and elasticity, and it's going to relieve painful sex, itching, burning, odor, discharge, and it's going to support a healthy pH. I wish I would have had that.
They say just use some lube, but to your point, we need more than just lube in that time.
That's right.
So Dr. Chang formulated these 3 different levels of vaginal moisturizers based on a woman's age. So gold is for women under 45 and premenopausal. Silver is for women experiencing moderate vaginal dryness for women 45 to 55. And silk is for women 55 to 70.
Please make sure to check out the more than 72 reviews to see how women are using and loving these New Weave products.
Moving on to vaginal atrophy. It also causes vaginal walls to become dry, thin, and inflamed. But this is not a minor setback. This can become chronic.
I just want to do a little pivot here. So besides the thinning vaginal wall skin, the other thing we need to discuss is your vaginal canal is a muscle, like every other muscle in your body. So if you don't exercise your vaginal canal, you are going to lose that muscle tone. So it is so important to do your Kegel exercises. Amy, let's do our Kegels.
Okay.
I'm doing my Kegels.
Yep, doing mine too.
I'm doing my Kegels.
I try to do them at every red light. That's my daily reminder. Whenever I see a red light, I do some Kegels.
So it's so important to do your Kegels, which are super easy. And if you don't know how or where they are or what to do, I have made a Kegel video and we'll link that in the description below.
Please leave us a comment or shoot us an email if you'd like for us to do a full video on Kegels. These are a way for men and women to make their sexual experience from beginning to end so much more pleasurable.
And Kegels also help with vaginal atrophy, which is often caused by a decrease in estrogen level.
So the important thing that we really want to emphasize is that vaginal atrophy can develop slowly.
Yeah. And while your vulva and vagina are gradually changing, you might not notice, and or more likely, you will probably make accommodations and workarounds to deal with the mild uncomfortableness.
It probably won't be an issue at first until several years after menopause. But once you have vaginal atrophy, it takes a while to turn it around.
Here's the really good news.
Yeah.
Many women who were unable to have intimacy for 10 years were able to have intimacy again after using New Weave Silver for only a few weeks. That's amazing.
That's amazing. New Weave also does not contain any estrogen, progesterone, herbs, or drugs. And that's what makes New Weave perfect for women that want to avoid hormones, such as some breast and ovarian cancer survivors and previvors. New Weave is also perfect for women who are wanting to supplement their estrogen replacement therapy with something extra. I'm all about layering on those different types of solutions.
For sure. Now, if you're listening to this and it's piquing your interest, I want you to pay attention to what's running through your head right now, specifically why you can or cannot do vulva care.
Maybe you're not having any signs of vaginal discomfort at this particular moment, so it's way down on your priority list.
So here's my third shameful confession. So now that I've almost reached menopause, fingers crossed, every once in a while, intercourse is uncomfortable, and on a couple of occasions, it's been painful. And I am too embarrassed to stop intercourse in the middle of things, but I'm obviously not enjoying myself because it's a terrible experience. Lubricants do help, but that's not the answer. So now I'm having to backtrack and start creating good vaginal care habits. And a big part of me hopes that I'm not too late and that this painful intercourse isn't going to become a regular.
Mm-hmm. Well, it's never too late. And as your friend, as your co-host, and as an intimacy coach, I would suggest sharing this with your husband outside of the bedroom and maybe asking if he can check in with you as intercourse starts. And that will give you an opportunity to speak up, because in the moment, it really can feel too embarrassing. So we just push through.
Yeah, and I have talked to my husband, and we've come up with a signal.
Good.
Like if I give him the signal, then and he's fine with it. And so it's all in my head, and that's the thing. Every single time, it's always in my head. So yeah, he's fine with it. We've got a signal, and we're good. But having that conversation, it took a lot of moxie and. So today we're making shame our bitch. And I just want all those women who are pushing through to stop it, to make shame your bitch and just tell your partner what's going on. Because trust me, now that I'm experiencing vaginal dryness and vaginal atrophy firsthand, it's so important to be proactive. So if you know vaginal dryness and vaginal atrophy will probably happen to you, then get into some good habits now so that you don't wake up one day with a vulva and vagina that are going to need a lot of TLC.
Sounds like I need to get some New Eve Gold and get started.
Yeah, I think we both do. I think we're both going to be on the website today for sure.
Absolutely. No, actually I am. 100%. We've convinced me.
And me too.
And we've convinced us. And these habits, they don't have to be complicated. It's actually a very easy fix. It's believing the quality of your life and your vaginal health are worth it. Talking about skincare, I recently started a really solid nighttime skincare routine, and I'm going to add in a vulva care routine for myself as well.
It's so smart. It's so very smart. For example, you can do like Amy, do a skincare up here and a skincare down there. That's perfect. Or you can start on Sunday, then apply on Thursday, Tuesday, and the following Sunday. Marking your calendar or setting a phone reminder can help you stay on track.
So we have talked about vulva and vaginal health, but what about the rest of the body?
Yeah, we would be remiss if we didn't mention an additional way to help ease women who are experiencing low libidos.
Female sexual desire is complex, and it's got many layers that are influenced by emotional, psychological, and hormonal factors.
And a woman's sex drive is influenced by many things, including sleep, stress, alcohol use, and prescription medications.
Limited research has shown that there are some supplements that can improve female libido.
Libido supplements for women can help increase sexual interest and arousal and improve the physical and mental aspects of sex.
Supplements can help to balance hormones, and that can increase your sex drive.
Supplements can help increase blood flow to intimate areas.
And they can affect brain chemicals like dopamine and norepinephrine, which can help with arousal. However, we need to clarify more robust clinical trials are needed.
Yeah, I agree. And yet, there is no one fit solution because every woman is different. So I believe in throwing everything at this challenge. Try meditation, try exercise, try supplements, hormone replacement, and salves, and see what works for your body. And it probably will need tweaking as your body ages.
So Dr. Chang created Crescendo for libido support. This is a supplement which fuels the spark, ignites the flame, and enhances your vitality. Crescendo has 2 key ingredients. Are you ready? This first one's a little funny. Horny goatweed and maca.
So I always feel like a 14-year-old boy whenever I say horny goatweed. But trying to be serious, professionally, I've heard so many good things about horny goatweed.
Horny goatweed is a traditional Chinese medicine, and this has been used for over 2,000 years to enhance performance in both men and women by improving circulation to intimate organs.
And this is a grocery list of all the things that horny goatweed can do for you. Are you ready? Okay. It alleviates premenstrual syndrome or PMS and menopausal symptoms, including mood swings, fatigue, irritability, breast tenderness, appetite changes, sleep issues, depression, vaginal dryness, anxiety, brain fog, hot flashes, and night sweats. I think we should all be taking horny goatweed, like right this second.
And then there's maca. The impact of maca on women's libido is under study right now, with researchers suggesting several theories. Its rich composition of nutrients like zinc, iodine, and essential fatty acids supports a healthy sex drive.
Traditionally used by Andean women, maca is renowned for boosting libido, aiding menstruation, and promoting hormonal balance.
Every busy woman deserves energy and passion in your day.
And what I like about the New Eve website is that it is full of researched information because it is so important to be educated and informed about what you're putting on and into your body.
Dr. Chang's team has done an excellent job in explaining what each product does in an easy to understand way, which can be really tricky.
It can be, and they do such a great job.
Yeah.
So please check out New Eve's product reviews to see what will work best for you. And you will find an affiliate link in the description where you can get a 5% discount by using the code SSP.
So here is what we learned today. We discussed the difference between BV and a UTI and how both can cause painful intercourse.
We then discussed the difference between vaginal dryness and vaginal atrophy. And you do not have to suffer. There are easy solutions that are one click away.
It's an oh-so-easy solution of getting into good vulva habits, making sure that you use the New Eve product line.
And if you're also experiencing the psychological effects of low libido, consider New Eve's Crescendo supplements.
The combination of taking care of your vulva and your body will have you feeling better.
And take it from me, there is nothing better than when you've been suffering and suddenly it's like the clouds open and have parted and you're back to your old self.
Please subscribe, like, and leave a comment on this episode.
Your support helps grow our channel and women's sexual pleasure.
Head on over to New Eve's website, and remember, supporting them is supporting our podcast and our work, and we both greatly appreciate that. And remember, when you take care of your vulva, she will take good care of you.
Until next time, stay sexy.
On next week's episode of the Sensational Sex Podcast. It's 2025, people. Why is there still a stigma about buying a sex toy, especially for moms?
We have so many questions that we need to answer during this podcast. First of all, what do you look for?
How do you get started with a new toy? How do you shop discreetly? Where do you hide your sex toys? How do you shop for them?
Then at the end of the podcast, you're going to find out how to care and store your vibes, how to use them discreetly, and what you can do if your kids find your vibe.
Are you struggling with lack of desire, mismatched sex drives, pain, or peri- or postmenopausal shifts that affect your sex life? Are you craving more pleasure and passion in the bedroom, but you don't know where to start? At Suburban Intimacy, I offer a holistic blend of one-to-one coaching, educational workshops, online events, and curated by a sexologist intimacy products. Book a complimentary discovery call at suburbanintimacy.com. And while you're there, download your 5 free tips for sexy scheduled sex. Want to spice things up? Save 15% off your first order at suburbanintimacyshop.com with the code podcast15.
Is good sex on your mind but not in your bedroom? Go to trinareed.com and check out my award-winning books, The Sex Course and Sex Boot Camp. While you're there, grab your free copy of Sex Boot Camp Masterclass and sign up for my Success newsletter to get weekly freebies and easy ways to help you become the juiciest, sexiest version of you.